Hi, I'm Morgan Turner, Health Education Assistant at the Human Development Institute and Special Olympics athlete and athlete ambassador. This series, titled Morgan's Musings, is dedicated to learning about disability, health, advocacy, and leadership from all different types of people. We will talk with disability self-advocates, caregivers, and parents, and people that work with individuals with disabilities. We hope this series of interviews help teach you to become a leader and a self-advocate in your own unique way. Hi, I'm Morgan. Welcome to another episode of Morgan's Musings. I'm here today interviewing my colleague, Lindsay Mullis.
And friend.
And friend, yes.
Yeah.
Thank you for letting us interview you today.
I am so excited about this. This is great.
Me too. So fun.
So my name is Lindsay Mullis, and I am the Inclusive Health and Wellness Director at the University of Kentucky's Human Development Institute. And so Morgan works with me on my team as our health education facilitator, and we focus on inclusion in health programs and services for people with cognitive and mobility limitations, but really just making sure everybody can be healthy.
Yes.
Yeah, really important.
No matter what your limitations are, you can still be healthy.
That's right.
So can you tell us about Caroline and the journey of bringing her home?
Yeah, we adopted Caroline from China when she was 3 years old, and along the process of filling out the paperwork, we found out we were pregnant. So a week before my husband left for China to bring her home, her sister Marcella was born. So we went from no kids to 2 kids and one with a disability. And so it was an incredible journey, quite the learning curve, right?
Right.
And it has been an absolute blessing. And what is interesting is where we did struggle to get pregnant beforehand, I think the reason why is that Caroline was waiting for us. She was meant to be a Mullis, and she was meant to have Ella, we call Marcella Ella, as her sister. And so having that faith that things happen and fall into place the way that they're supposed to be, we were all meant to be together, which is really, really incredible.
Okay, so before was adopting someone with a disability something you've always wanted to do?
We actually, Jesse and I, my husband, we get asked that quite a bit, and the answer is yes. We were inspired by another family who had adopted 2 children from China with special needs. Their son had a cleft palate and their daughter had spina bifida. And so to see their stories unfold and how happy and healthy those kids were really, really inspired us to want to be able to do that because we love kids. We knew we wanted to have a big family. And so when we started the adoption process with the Great Wall of China, it was actually interesting because I think they're so used to trying to convince parents to be open-minded and consider disability that when we said we only wanted to look at special needs, it flipped the script a little bit. And so it was really an incredible process to do that. And and I would encourage anyone who's interested in adoption to be open-minded, because everybody, like I said before, has their own unique challenges and strengths and weaknesses. And so with Caroline, it just looks a little bit different. And we are so grateful to have her, and she's really enriched our lives so very much. And I can't imagine Caroline not being a part of our family.
And I think it's important people should think about adopting someone with a disability, because looking at Caroline, she's so cute and still active, and it seems like nothing slows her down.
That's true. And I think maybe as a parent it's scary. When Jesse and I did talk about it, he initially was open to adopting a child with a physical disability, and then he saw Caroline's pictures and video and was like, that's her. I said, well, she has Down syndrome. Let's talk about what that means. And he asked me a lot of really great questions about what her life would be like, what kind of barriers she would experience, about what our life would be like as her parents, what our retirement would look like. And those are great questions to have. And we talked through all of that and all of the things that might be intimidating, and realized that, in the end of the day, her happiness is really what's worth it, and that we had the ability to give her a happy life. You did it. Good job, kiddo. You give Morgan a high five?
High five.
Boom.
Yay.
Yeah.
Can you tell us about being a mother and an advocate for someone with a disability?
That's an excellent question. I think it's really important to not necessarily take the first answer as the final answer, especially if that is no. I think that's what it means to be a strong advocate and a good parent, to really take that opportunity to educate, to push others' knowledge or their boundaries of their acceptance. And so a really great example of that is when I wanted to enroll at the Little Gym, which is a gymnastics facility that we're here at today. I first called and explained the situation with, I've got my 2 girls, one has Down syndrome, so even though her birth date would put her in an older class, where she was adopted, she doesn't speak English, her muscle tone is really low, so we're still working a lot of those things. She's not at the ability level of that higher class. And so initially, I was told, no, we go by birthday and that's what matters. And I had to take that opportunity to educate, the facility and the professional on the phone as to why there needed to be this consideration on an individual level. And I was able to, speak eloquently enough then that the young lady on the phone could speak to the owner well enough to be able to advocate for me on my behalf to let us have Caroline and Ella be in the same class, which was an incredible thing for the both of them, and they've both improved so much with their physical ability, their social skills, and it's just been an incredible experience that had I just taken that first answer of no, it's based on your birthday, then we wouldn't be here today. Yeah.
So can you tell us about the Little Gym?
Yeah, so the Little Gym is a gymnastics-based program for kids ages 4 months to 12 years old, where we focus on the main development milestones, gaining confidence, having fun, developing strength, all in a non-competitive environment.
Yes.
And it's a lot of fun.
Yes, and that's what life should be about, is having fun with whatever you do.
Yes, exactly.
So what is it like having Caroline in your class?
Caroline's a joy to have in class. She always comes in with a smile, always ready to have fun, do all of her skills, and she's an absolute blast in class.
So what are some modifications you had to, did you have to change anything because Caroline was in your class, or?
Well, when Caroline first came in, she was a little nervous of certain things in the gym, so I definitely tried to welcome and encourage her into the skills and the activities. I did a little extra spotting with her on the beam, on the high bar, anything that she was really nervous of. We provided some extra spotting for her, and the main thing was just for her to get comfortable at her own pace. So we didn't try to push her or anything. We wanted to wait till she was encouraged and she was confident enough to come up to us.
I would have never guessed she was nervous. I've seen her before, or this morning, and she was doing flips and...
Oh yeah, she's been here over a year now, and her confidence is not even a year. Oh man. Well, her confidence has grown so much, and she's made so much progress here.
Good.
So what's it like having one child with a disability and one child without a disability?
I think it's definitely about managing expectations. Whether you have a disability or not, we all have our strengths and weaknesses, and we all have good days and bad days.
Good job.
Nice. Come here, Caroline, come do it again. Come on. So I think it's all about, no, she's done. So I think it's all about how we manage that. We want to have high expectations for our children. We want them to be the best that they can be, but also understanding that sometimes we need to be supportive and understanding as well, and try to encourage that no matter what. So sometimes Caroline's the one that is motivating and encouraging to Ella to help her be successful, whether that's going to the dentist. Caroline was fearless, and she went first, and it was then after Ella saw her that then she wasn't scared, and we were able to use the spin brush on the second time that she was in the dentist chair. So I think that's incredible that she's that leader, and then there's other times that it's Ella who encourages her and helps her be successful. So yeah, making sure that you're supporting both of them in the way that is appropriate for them specifically.
So does one keep you on your toes more than the other?
Yes, and I bet my answer will surprise you, because it's not this one. It's actually Ella. She is a handful. She's stubborn and headstrong, and I mean, Caroline definitely has her stubborn streak, but what really is so interesting is their bond together as sisters. They're so cute together, and they really help one another. And so I'm actually very grateful for Caroline and the way that she helps me with Marcella when she is a little bit wild, right?
Yes.
Yeah, so I'm very grateful for my little helper. See,
So
even
they're
right
there
now,
for
we
each other.
couldn't get this one on the bars, but she sees Caroline do it, and so,
Whoa!
yeah.
Yay!
Good.
So do you think it's important for individuals with disabilities to hang out with friends and do like outside activities and stuff with friends?
I saw you did such a good job. Go do it again. Yeah, absolutely. That's why we love it here at the little gym, and we're so grateful that they were willing to allow us to bring Ella and Caroline together, because they get to interact with their friends and their peers, and they see others doing the skills, and it helps them model each other, and really getting to see them interact is great. And not only that, but then it's also an educational opportunity, because Caroline is one of the tallest in the class, but she's not necessarily the most advanced at some of the skills. And so having the opportunity too to talk to other parents or kids that might ask questions about why Caroline's a little bit different, I can talk about her disability, or say Caroline has Down syndrome, and they have an opportunity then to ask questions and then see her be successful at what she's doing, which is incredible. And then that also gives them that normalcy about that people with disabilities can do anything, and then the kids see that and the parents see that. And so I'm really grateful for that opportunity to do that here.
I'm seeing that a lot lately, like
Yeah.
now that people, I guess, know a little bit more about disability, and they know that they're just like everyone else. Maybe they just have to have some things that modified for them, but they're still doing the same thing everyone else is doing.
Yeah, exactly. Yeah, and look at them go.
Yep.
Good job.
Woo!
Good, high five. Boom, nice.
All right. Aw.
I did it.
I saw you did a good job.
What do you think makes a good leader?
I think having the courage to try, and maybe the courage to fail, and then to learn from that so that you can be better and do better, and then educate others about that along the way. I think that that's an important part of being a good leader.
Yes, failing is not always a bad thing. You either do good or you learn from it,
Yeah,
so you know
that's right.
what to do and expect next time.
Yeah, I think it was Winston Churchill maybe that said that failing isn't fatal. And I like that.
Yes,
Yeah.
I do too.
Awesome.
Thank you guys for watching Morgan's Musings. Be on the lookout for more episodes. Be sure to, you can watch them on our Facebook page, Wellness4KY, and you can also watch them on our YouTube channel. Thank you.